Yes. Good evening. Can you hear me?
Hearing, but not well. I'm going to increase my volume.
Hello?
Hello?
Can you see them?
Are you able to see my video?
I see you.
Yes.
Yes. Okay. Reason I can't see your videos.
ต้องพูดไหม
There you go. I see one. You can. Good. Now I don't.
You see. You can see all. I never see anything. Now I see Dr. Prince, Dinah, Mary, and Kat, Ollie.
Mình không biết kiểu mà là thư viện này là thư viện này là thư học riêng và thư viện ở đây là thư viện không phải học thư
Here. Okay. Or to see who's on. you ready to start? You are not at the school, you're at your home, is that correct? Sense of, you know, where everybody is. If you could answer, that would be great. So,
Yes.
just get started. You know, usually in doctoral programs, you know, we kind of have an expectation that there's some participation from the students. And so I don't want to lecture this entire time. I want to have a discussion, especially about the concepts that we're going to be talking about, because they have a tendency to be very abstract, and I want to ensure that people understand what I'm talking about. So at certain points, I'm going to ask you to kind of take some time out to think about things and then to respond. So what I'm trying to get a sense of is, are you in a classroom together, or are you out individually in your homes? And I mean, if you prefer responding to the chat, that would be fine. I'd like to have a response from people, so either verbally or through the chat window. I'd like to know where people are. For some reason, not hearing anyone.
Good evening, ma'am.
Hi, how are you?
Actually, there is unfortunately some problem, so we cannot hear you properly.
Oh, okay. So someone going to work on that, or?
Ma'am is trying to set the problem.
Oh, thank you very much. If someone could let me know when I should start, that would be helpful.
Please check if it turns red, it means that has a message.
So how are you doing? Okay. So my video. Okay. Am I still there? Um, so I have to use my other computer that doesn't have a webcam, unfortunately. Um, so I'm okay. Great. So you all should like next to your name, you have a little hand. And it allows you to raise your hand. Could you click on that so that I can see that you hear me?
Yes.
You hear? Okay.
Yeah,
Great.
I can hear. Yeah.
Excellent. Wonderful. Okay. So I guess we'll just get started and we'll just do the best that we can. If there isn't a lot of opportunity for us to interact, this may be a little short because I did want I have some exercises that I wanted to do to you in terms of kind of getting the material. So I think what I'll do is I'll go over my presentation first, and then after that, what I could do then is for you to introduce yourselves, and I might ask you some questions about, how your program of research might relate to what we're talking about today. So when you get ready to introduce yourself, what I'd like you to do is, obviously tell me your name and where you're from, and maybe a little bit about why you decided to go to a PhD program, and just generally what your research area is, so that we can all kind of understand, which focus you will have during your program. Okay, and let's share my screen now. Second, I'm going to try to open up. Okay, so now if you have some questions, please use the raise your hand feature, because that will help me to know that I'm saying something that you're not understanding, okay? And then also, feel to use the chat. What happens is when you type in your question, a little like pops up, and so I should be able to see it while I'm talking to you. Okay. So, share my. Okay, it might be computer and all of my documents on my computer, and I just wanted to share with you a little bit about where I'm from. I live in Washington, D.C., and so these are some pictures of Washington, D.C. if you ever come to visit. This is a picture of the different monuments. Monument, the Lincoln Memorial, and the Capitol building, which is where the Senate and the legislature are. Here's another picture of the Senate building here. I wanted to find a picture of the White House. White House, which is where the president lives. And just really maybe about 5 away from all of those monuments is the university that I work for, George Washington University. And this of one of those on our university. So we're to the White House and the CN and all of the different monuments. All right. And about me, I think hopefully you got this information sheet that I sent. And to let you know a little bit about myself, I'm an associate professor at George Washington University, and I'm the associate dean for graduate studies. I have worked with master's students and doctoral students, and most recently with doctoral students. I developed the Doctor of Nursing Practice program at GW, and I taught in that for a number of years. My interest in research is primarily related to education and nursing, so I'm interested in technology in nursing as well as interprofessional education. I've been working on another study looking at the type of nursing research that is being conducted in magnet hospitals, which are a type of hospital in the United States that have a special designation. So that's just a little bit about me. Well, I guess the topic that I was asked to speak about today was the concept of paradigms. And paradigms are an important aspect of conducting research because there are a number of different types of research traditions and research methods, and each of them and do the investigation, the investigative processes in a way that's very consistent with the paradigm, and is really looking at different types of information. So understanding the underlying paradigms within these different research traditions is helpful in ensuring that you create and design very consistent research. The other thing, kind of before we move forward, and that is, walk together. It's really important to all learning, and so I wouldn't have any expectation that you would know all this information before we even had a class about it. I asked you to read some articles. I've asked you to sort of think about some questions, but I don't have the expectation that you know all of it. So if I call on you, and I wouldn't normally call on you specifically because it seems kind of like challenging you, but the environment that we're in, I think it's going to be hard for us to have a discussion. And so if I call on you again, that doesn't mean that I'm testing you. I really just want to know what you know, and I want you to, sometimes when you kind of talk out loud, it helps you to understand concepts that you're trying to learn better. So don't be afraid, I guess is what I'm saying. So one of the things I wanted to show you before we even started our class is, and since this is a class on theoretical foundations, it seems this is an appropriate model to share with you. And this is the cognitive apprenticeship model. And it's more of an educational theory, but it's very much a theory that is usually underlying most doctoral programs. So in the past, when you've been learning in nursing, often you may have learned through attending lectures and doing readings and going to clinical. But often your faculty member was kind of the expert, and you were basically listening to what these experts said and trying to memorize and utilize that knowledge to pass tests and other things. As you move forward in education, especially in doctoral programs, you really being required to be more interactive and more engaged in the learning. The faculty member is not now the expert, and they may know somewhat more than you are, but really what they should be doing is engaging you in understanding what these concepts are and to be able to apply them to your program of research. So, at this point, you may be having tests, and especially you'll have a comprehensive exam, so in some sense they're right and wrong answers, but the reality is if you have a good argument for something and you can support that argument with evidence, then there's different right answers. So what the most important thing is for you to be able to learn the material critically and to be able to apply and provide sufficient rationale for why you're doing the things that you're doing within your research program. And so the way that that faculty help you on this journey is to do a number of things. So they may where they kind of show you what they've done along the way to help you maybe understand how you could develop your program. They will do coaching, and coaching is very different than telling you. Coaching requires the person to find sort of gaps in your knowledge and then help you learn and achieve those that information. So, for example, this is something that happens in the PhD process, all along, is when you're trying to develop your research question, which is the key to everything. And so you may go to your advisor and you might present the research question that you thought of that week, and then they say, oh, is that really what you want to be doing? And what if you look at your research in this way, then this is what you might be finding. Is that what you want to do? And asking you questions to ensure that this research question is appropriate for what you want to study. So not telling you how to do it, but helping you learn yourself how to do it. The third thing is something called scaffolding. What scaffolding means is that, actually when you're in a program, we provide a lot of supports, much like scaffolding does when buildings are being built. But as that foundation becomes stronger and stronger, so that you're learning material and you can apply it, we start taking the scaffolding away so that you're driving your own education and what's there to support you. There is something called articulation, and that means speaking about what you know. And that's why many classes in doctoral programs require you to talk about what your understanding is. And through that discussion of what you understand, it helps you to learn better. Reflection is another piece. Sometimes faculty will ask you to write journals to kind of help you reflect on what you've learned and how you can apply the material. Sometimes we ask you to do exercises within classes that also ask you to reflect. And the last piece is to explore. So it's your opportunity to explore kind of ideas. Have your focus, your research focus, hopefully, which will drive kind of your whole education. But this is your opportunity to explore that even more so that you really learn and become expert in your topic area. So these are the sort of the building blocks of doctoral education and why it's somewhat different than education has been in the past for you. And as you can imagine, that's what makes doctoral education different. It's really asking you to learn and dig deep inside and create something brand new. And this is a process that can take time, can be challenging, but it's also very rewarding because it allows you then to have the final product, which is your dissertation. So forward, I just would like to with everybody to see, does that make sense? You either can or you could send me a chat note. Okay, heard me, Raymond, or Rizman, I think is what your name is. Okay, hoping that everybody else has heard as well. Okay, I'm going to go forward and talk about paradigms. Presentation, we are going to try to define, oops, let me make this. We're going to positivist, interpretive, critical, and constructive paradigms. Oh, and I forgot the post-positive, which we will also look at. Describe how paradigms influence our view of reality and knowledge. An idea of paradigm shift and how it applies to nursing and health care. I have this question for you, and I would like you to respond to me. What picture of? What is this a picture of? So we could type in the chat what you think this picture is. Okay, so it's a head of a bird. A duck. Way. Else? So if you kind of look very carefully at this picture, you get this way with Bill over here. It looks like a duck. However, if you start looking over at this end with the mouth and then the rabbit ears, you can both of these picture can be both a duck and a rabbit. A really important takeaway, if you take away nothing else from this lecture, that paradigms are a way of looking at the world. And individual people, as well as research traditions, can same type of phenomena in a different way. And so identifying kind of the research paradigm is when developing your research is important because it allows you to be consistent with that worldview or paradigm. Any of you have ever read the book The Little Prince? There's a similar lesson within this book, and that's that there's more than one way to look at things. Again, in the chat, what does it look like? A hat. Yeah, could be. All those things. Okay, maybe someone has read this book. So, but according to the book, it really is that's been by a boa constrictor. Again, as you can see, you look at something one way, but it's something totally different. So a paradigm, get rid of this. There we go. Is assumptions, concepts, views, and practices that constitute a way of viewing reality for the community that is them, especially intellectual discipline. So they're often referred to as a worldview or a way of looking at a discipline and its science. So Thomas Kuhn is someone who wrote about paradigms, and he wrote about paradigm shifts, which occur when empiric reality no longer fits the existing theories of science. So we'll talk about that a little bit more later. You know, what Thomas Kuhn had described as a paradigm shift. Give you that article about that was written by Lincoln and Guba, which is kind of like the seminal article on the concept of paradigms. And what they say is that worldviews of scientific phenomena differ, help shape the theories that are derived from them, help in the conceptualization and design of research. So, you know, it's a very little thing. I mean, you don't usually spend a lot of time within your theory course talking about paradigms, yet kind of the overlay that the overall theory and design of research. The concepts is very important. Hopefully you've also encountered these terms before, as ecology, epistemology, and methodology. Ecology is about the nature of reality and what can be known with a particular tradition, within that tradition. Now, epistemology is how you come to know something with that tradition, and said really have covered that in some of the previous lectures. How do I know things? You know, how do I know that the sky is blue? How do I know that, you know, the table is flat? You know, what is it that helps us to understand this type of reality? Methodology is the way a researcher can find out about what they want to know or what they want to investigate. You know, they research question. I wonder about this phenomena, and then they how do they investigate it? What are they can learn about this phenomena more? And you know, this is, you will find that many authors write these paradigms differently, or they may call them different things, but essentially the same, even if they have different names. And the two that are very consistent across all, you know, people who write about paradigms in philosophy of science, and that is positivist and the post-positivist paradigms, which are traditional research traditions. There's also the critical paradigm, the constructivist paradigm. Sometimes it's also called the interpretivist paradigm. So I kind of will use those two words similarly. However, you know, people within that might, you know, but they kind of are similar. Go forward. Are you with me? You can either, or you can chat. Question, let me know. All right. Hey, I'm glad you're here. I guess another question is, have you encountered these terms before? No. Okay. So they're new for you. Anyone? It's okay. Great. Some are familiar, yeah. Okay. Well, what we're trying to do is, you might have heard these terms before, but we're trying to put them into a framework so that you really can understand it a little bit better and utilize it. So the positivist, the purpose of it is to really describe the phenomena that we experience. So it's about observing, what can we observe in the world and what can we measure in the world. And understanding the world so we can predict and control it. And it's about seeking the truth. What's true about some particular phenomena? Why rotate around the sun? That sort of thing. All right. The other aspect of the positivist paradigm is the concept of cause and effect. That one thing causes another thing. Okay. When we are looking at research, that's what we want to know. We want to know what causes what. Cancer. Do we have enough evidence to show that smoking indeed causes cancer? Effect is a very important aspect of most of the research that we conduct, especially in healthcare. We're often trying to find out what is the cause of disease, what is the cause of types of problems within our patients, and then can we, them? Are there interventions that help us or improve the quality of life or some other aspect for our patients? Aspect that's common with positivist view is deductive reasoning. What we do then is we different types of theories, and then that we can test. Think about the germ theory. This was a concept that people really didn't understand before they could actually see these microorganisms. So, if you propose that different types of microorganisms cause infectious disease, then how do you go about testing that theory to be able to say that it's true? So based on the results of our studies, we may learn our theory doesn't fit the facts so well. We need to revise our theory to better predict reality. So in nursing, and it doesn't actually have to be in research, but it could be in clinical practice. And tell us, what conventional wisdom was, and then you have to revise it when some new information came about. Anybody thoughts about that? Well, about that, and we will come back to that when we talk about paradigm shifts. And empiricism often you might hear the term, empirical data versus other types of data. So this is a concept that observation and measurement are the core of scientific endeavor. Think about how, especially in nursing, how we attempt to certain types of outcomes or behaviors or whatever. Because, a lot of the things that we're studying are not concrete. Think about the type of variables that we are interested in. Quality life, depression, anxiety. These are not things that you can directly observe. So how do we then measure these phenomena? How do we develop measures so that we know that, yes, somebody has a quality of life or someone does not have a good quality of life. Key approach to the scientific method is the experiment. We attempt to discover natural laws through manipulation and observation. So when we're thinking about experiments, we have our control group, then we have our experimental group, and the experimental group, some kind of intervention where you're applying the intervention to the experimental group and for results. If I give pain medications to someone in pain, their pain is reduced. So that's like a way of calculating and then observing the result. Okay, paradigm. Oop. I'm going in the wrong direction. Sorry. And so when we're thinking about the ontology of positivist, it's black and white. It exists because we can observe it, and it's done by some type of natural law. If I take a ball and I hold it in the air and then I drop it, it will fall because there's gravity. So the types of things that are the positivist paradigm. And in terms of the epistemology, we know something happens in a very objective way. We can measure it. And generally the methodology that we use is some type of experimental method and it's primarily quantitative data. Positivism, like a little bit of positivism or positivism light. It's almost a rejection of some of the most basic aspects of positivism. That it comes from a very traditional paradigm. However, post-positivist is a critical realist, meaning practical, pragmatic, who recognizes that all observations are fallible and can be revised. Important because as you move forward in your research program, what you're learning about is type 1 error, measure, bias. Different things that you look at when you're designing research and when you're critiquing research, because often research designs have some element of these things, and what you're trying to do is minimize it to have the best design possible. But when we think about how we even report research findings, we often will say this causes that. But we say that the evidence supports that that or this has an effect on that or something like that. We don't usually use very definitive terms when we're operating under the post-positivist paradigm, because as we have said, fallible, and the error and bias associated with those aspects of the research. Where the positivist believes that the goal of science is to uncover the truth, the positive believes that the goal of science is to hold fastly to the goal of getting it right, even though we never achieve that goal. So to the positivist, and I would say that that's probably where most social scientists, and that would include people in healthcare, subscribe to, it's that we try to get as close to the truth as possible, but we never know whether it is actual or not. Measurement is fallible. The positivist emphasizes the importance of multiple measures and observations. So, we would never say that one experiment, that certain results would be the all and end all. Really, replication of research is important so that we know there's a growing body of evidence that tells us that this is the reality. And the post-positivist believes that all observations are theory-laden, are inherently biased by own cultural experiences, worldviews, etc. So that means that when we're conducting research, we need to understand that we bring certain biases to our research, and we need to control for those and understand how they have an impact on the research we're doing. And often we think about biases being related to sort of people. Perhaps you may have a certain view of different types of people and what their response will be with the research area. But you can't always know that to be true. And so you need to kind of put those biases away when you're conducting research. So before I go on, I want to stop and say, how are we doing? Do you have any questions about what I've talked about so far? And do you want to? So if you either can give me a text or I can go on. All right. Ecology of post-positivism is that reality can never be fully known. Ecology is objective, and the same way is that it's experimental and quantitative methodologies. The difference between positivism and post-positivism. I would say that most people who are doing research in the social science realm would consider paradigm as being post-positivist. Probably people who are more in the basic sciences where they're doing things by observation, they may be more positivist, but positivism seems to be the predominant tradition at this point. Okay, the paradigm that Guba and Lincoln talk about is the critical paradigm. And the critical paradigm is different because it doesn't talk about what is the truth or initially objective, because what it is reality is created and shaped different aspects that surround us: the social, political, cultural, economic, gender-based forces that have realized over time into the social structures. So you can't, what they're saying is that there isn't a particular reality. It's more about what are the influences that surround this idea and how they've changed the way we view or look at it. Certain theories are very consistent in the critical paradigm, like feminism. Paulo Freire talked a lot about how different groups who are oppressed behave differently because of this oppression of society. Marxist theory is related to the critical paradigm. And the of the critical paradigm is that reality is shaped by social and political sources. So this is a very important type of theory when you're looking at vulnerable groups. People choose to use this type of theory. Say you're to study homeless people, or another type of oppressed group, who have been trafficked. People who are living in certain income areas or slums, and how maybe they don't receive the same type of education. Maybe there's a lot of cultural bias against them. So then does that type of and cultural force then their reality? And so the epistemology for this is very subjective. It's not objective at all. And it's also value-laden, meaning there's a lot of cultural influences that affect how we know about this particular thing. And the methodology of critical paradigm is what is referred to as dialectical, meaning that you can't know what experience is, especially different worlds than that group. You have a dialogue and let you talk with that person. So often the research methods that are used with this paradigm, the research participant in research. So like one particular type of research that would be very characteristic of this paradigm is action research, where you're actually conducting the research with the research participants. About them, you're learning about their responses to things, and you're including them within the research. And the last one is the constructivist or the interpretivist. So again, different terms. But I just kind of like to think about the constructivist as as the fact that we construct our own reality. The ontology of our paradigm is that you can view from different perspectives, that each individual experience, those experiences color they view reality. So think of a concept of like cancer, okay? I, as a person who has never had cancer, view of what cancer is, based on not experience of it, personal experience, but in caring for patients who have cancer, of being, a member, through a family where people have had cancer, or a friend of someone who's had cancer. I have that perspective, but I don't know what it is to have lived through cancer. So my vision of reality about what cancer is different than someone who has had cancer, or someone who hasn't had cancer but has had different experiences with it. So the opinion can be both subjective and objective. So it's not like they are one or the other. The subjective part comes from how you gather the data, but the data itself, because then the data from people that have different viewpoints and different things about it. The objective part is you the data, and then you together in terms of the analysis. Do you use objective measures in gathering your data, an objective way of analyzing it? The methodology that you use for the interpretivist and constructivist paradigm are usually qualitative methods. Generally, the way you is either through interviews or from observing people. So I don't know if you're familiar with ethnography, but ethnography is a type of qualitative method where you actually a group of people that are of a particular kind of culture. Like, let's say you want to observe nurses. Sit like nursing unit to the side in a corner and write down what you've observed as happening. Okay, so that would be like an ethnography, and then an interview would be then if you want to understand what nurses experience, you find a collection of nurses and interview them to gain their experience of nursing is. When we look at these different paradigms, and I kind of clumped them together a little bit earlier, the positivist and the post-positivist paradigms generally are use quantitative methods. In terms of how they collect their data, they collect it through experiments, tests, and scales or measures. Interpretivist, constructivist paradigm, quantitative measures, and it's generally interviews, observations, sometimes looking at documents or visual data analysis. Okay, I'm going to stop again and ask, are there any questions? Okay. That's the best teacher in the world. I'd like to do, okay, well, now we'll talk a little bit about paradigms. I don't know if you've heard of Thomas Kuhn before, but he was a scientist and a historian, and he wrote a very seminal book called Structure of Scientific Revolutions. And, until this document, people basically thought that science, very incremental fashions, you do experiment, you get your results, you publish your results, people read your results, they what you said and then they build upon it. So it's all very incremental. But who said is that people don't, you would that if you have two people looking at the same view, that be the same thing because they're basically having the same experience. However, that's not the case. People don't see the same thing. Now, our knowledge is highly theoretical and abstract. Because of that and the fact that they're different people, they will have different views of the same or the same viewpoint. And so it's important that you can see things, one person can see things in a different way than another person. So as a result of that, people see the same phenomena and totally different ways of investigating and looking at the same information. I get this book in 1962 called The Structure of Scientific Revolutions. Really changed the way people discuss scientific concepts. And so what he's saying is most research takes place in a period of normal science, but then sudden and the science kind of gets upended when scientists find new and more compelling frameworks or paradigms interpreting the observation. So Newton overturning Aristotelian ideas. So to Kuhn, that suggests that scientific knowledge does not consist of straightforward accumulation of objective facts, but that we can always kind of relook and rethink, reality and what we know about a concept and create a new framework. So, to think of an example of a paradigm shift in your area of interest, and to start with, think how easily did people shift their thinking? What happened? Well, I'm going to ask some people to share their thoughts, but here's an example that I talked about before. So, for many years, did not understand how bacteria and viruses cause infectious disease. And so they didn't wash their hands when they took care of patients, and patients would become ill and die from not the original problem, but actually the germs that were transmitted to them. And it took a long time for people to understand that. And I think we might remember that story about Dr. Semmelweis, who his theory was that surgeons who had been doing autopsies were basically causing postpartum infection because examining women after they had handled infectious material and didn't wash their hands. And so his simple approach of washing your hands before you examine a patient was ridiculed because people couldn't see how that could be true. And obviously we know that being the reality, but at that point people were not ready to see, even though he had research evidence to show that it was true. Think about a paradigm shift and describe what happened in that paradigm shift. So, who would like to share a story? Okay, I'm going to call on you, Rich. So can you unmute yourself, or do I have to do it? Okay, just know what your example is. See if I can do it. To do it, I think the person that creating, but can you do it? I can make you a presenter. No, that wouldn't be good. So Lynn, there you go. Huh? Great. Yeah, I can hear you.
Good evening.
Good evening, or good morning for me.
Sorry, it's good morning. I'm Ritzman Loa. I'm from the Philippines. Hi. And my example about the paradigm shift is, in my country, we used to do newborn, as part of newborn care, we bathe newborn. But because of the new protocol, like the essential newborn care protocol, we call it in my country as unang yakap, or the ENC. We don't bathe the baby immediately after delivery. We baby stay with the mother on abdomen in order to prevent hypothermia.
Oh, okay.
Yes, and it used to be before that prior to cutting the cord, we milk cord. But with the new paradigm, we do not milk the cord anymore. We wait for the pulsation to stop before we cut the cord, and the rationale is it can prevent bleeding or vascular hemorrhages among newborn.
And people accept this new idea.
First, they're resistant to follow the protocol. Actually, those nurses who have been working in the room and time. But through education, in our Department of Health, went to all hospitals to discuss about the protocol and what the reason why do they have to change the way how we care for the newborn immediately after birth. And a law which date the implementation of that protocol. So I think that really helps on how we can change the people, especially the nurses, think on managing or providing immediate newborn care.
Great, that's an example. An example?
Hello?
I was thinking of you.
Okay, I'm Cynthia Kamamong จาก Faculty of Nursing ธรรมศาสตร์ University. You can remember me? Okay. My area is wound care nursing, and I found that the incidence of facial ulcer are severe and increasing every day. The paradigm shift in this area is to develop in nursing, fundamental of nursing, who want to develop together the knowledge of other disciplines such as medical engineering, because if change in the house, the caregiver must be reposition patient by themselves. But if we have the innovation, because it's advanced technology to improve the quality of care, so if we have innovation like this, it may be to change the protocol of reposition patient or another, and I'm not sure now.
So what you're saying is that you're want to examine interprofessional types of treatments for wounds and sort of synthesize that knowledge so that people are using that are effective across the disciplines. Is that what you're saying?
No, I understand. So,
do you not understand or you don't hear me? You okay?
yes.
Okay. So I guess I'm trying to kind of clarify what the paradigm shift is. So instead of using traditional treatments, that we should be looking at more innovative approaches to wound care.
I saw that the advanced technology to improve the quality of care in patients. So I think that the nursing care must be to change like this.
Okay.
That's sure. Okay.
Yeah. Okay. Great. That's good. So really looking beyond the nursing discipline to identify treatments that are. That's good.
Thank you. Very much.
So I think, is it Mani? Do you share what? No. Okay. All right. Well, I think those are two good examples. So then the next question is how paradigms are, how do these paradigms change the way we look at the world, and how do they change the way we conduct research? Kind of gave you some examples, and I'm going to ask you to give me some examples as well. Piece is, do you choose one paradigm when you're planning or in research, or is paradigm dependent on the question that's being asked? So think about that. So for example, sometimes you hear people say, oh, I'm a qualitative researcher, or I'm a quantitative researcher. And do they select that method because that's sort of how they like to do research, or is it because it's the most appropriate to the type of research that they're doing? So just kind of think about that. Okay, so there I'm going to. Okay, relate to the research. Okay. First of all, before we go on to introducing ourselves, I would like to see if anyone has any questions or any observations about what we've been discussing. Is there something to go over again that was here? So did Pitcha, did you question? Okay. All right. Sharing my screen. All right. And figure out how to get these videos. I guess what I'd like to do, oh, there we go. I control any of that. What I'd like to do is I really would like to have people kind of go around, talk about yourself and what you're planning on studying while you're in your doctoral program. And then, we'll sort of think about different paradigms that could be present within, research. So I have a list of you, so I'm going to just go through the list. And I'm not going to probably pronounce your names correctly. I apologize, just from the beginning. So, Achanat Wang, you're on. Would you introduce yourself? Oh, we can.
Hello.
We can hear you. Hi.
Good morning.
Good morning.
My name is Untitled Wang So. I am lecturer at Rangsit University in Thailand.
Okay. And what is your research area?
I'm interested area in patient with COPD.
And what aspect of COPD would you like to see?
Dyspnea management, symptom management.
Okay.
Management in patient with COPD. I showed in the Positivist program.
Okay. So you're wanting to use the interpretive paradigm, did you say?
Yes.
Okay.
Interpretivism, and I planning make method research design.
Okay, mixed methods.
Yes.
Yes, I would ask. So you're kind of wanting to learn about what your students' experience of COPD is. Is that correct? Learn more about how they experience their illness.
Hello.
Yes, now I hear you.
Experience with in patient with COPD often suffer from dyspnea.
Oh, so I'm just wondering if that's what you're interested in. Okay, great. Anything else that you want to tell us? Okay.
Thank you.
Okay, all right. Thank you very much. Okay, and so the next person I think on my list is Halima. Halima. There.
Good morning, Halima.
Oh.
Unfortunately, my system is not working, so that's late.
Oh, great.
I'm Hadia from Pakistan. I've been working as a Latin nurse college, and I was here for the study. Research area would be, I would like to work in community health nursing. So,
could you repeat that again?
community health nursing.
Community health. And what aspect of community health?
Previously, in the research book, I have been working on the health-related issues in our community during flood season.
So during flooding.
Yes.
What aspect are you looking at? Being displaced from their homes, or?
Yeah, they are displaced from their homes, and most of the women got problem in accessibility of healthcare centers.
Okay.
They got different diseases like TB, skin allergy, and all these kinds of problems.
Right. Okay. And so do you think, in terms of the different research paradigms, where do you think that your research falls?
Repeat the question, please.
So in terms of your research, where do you think that, and which research paradigm do you think your research falls into?
Previously, I was just using the questionnaire, and I was just observing. So the research paradigm which I was using was qualitative type of research.
In terms of your survey, you were asking questions about what people's experiences were?
In my survey, I have asked that kind of questions.
Okay. Do you think that you're going to stay with that paradigm, or are you going to move to something different?
I have to change because qualitative research is quantitative research is better than quantitative one. So to shift from qualitative to quantitative.
Okay. So, Guba and Lincoln would say that there is no best research paradigm, that they're all provide information that is important. At the same time, I think a lot of people may the more quantitative types of paradigms because and so I think that there's within healthcare, there's a very big emphasis on being generalizable, so that research that can be generalized to a lot of different populations. And so one aspect of qualitative research that's a challenge because you usually are only focusing on a small group. Okay, great. Let us know anything else? No? Okay, thank you very much.
Thank you.
Okay, so the next person on my list is Jinticha Mamon. Did I say that right? Sort of right. Why don't you share a little self and what your research area is?
What do you mean about my area of interest? Yes.
What is it? You're going to study.
I'm studying NS nursing, especially I focus in mental ulcer problem because I found that it increase every day and I cannot to solve by another evidence. I know that pressure ulcer problem have evidence to try to increase this problem, the severity of this problem, but I found that in Thailand, but have not the effective methods to
treat them.
Yes. So I am interested in to develop the innovation to improve quality of care of family caregiver, because family caregiver in Thailand have no one have in some family have one or none of family caregiver. So if we have innovation to help them, the quality of life of patient may be improved. I think.
It sounds like you know your area of research is more in the post-positivist paradigm, because you're interested in looking at interventions that would, you know, treat pressure ulcers. Is that right?
Okay, right. But I have some problem to ask you that what the trend about positivism and post-positive? What is the trend that I'm not understand?
Is there, you know, it's I'm glad you had that question, because it's very difference is kind of subtle. So let me go back to my sharing my screen. Wait a minute. Screen again. Okay, so when we look at the positivist, that says that I know some because of what I see and I observe. And there are certain truths within the world that are absolute, and that we know that this is one thing may cause another thing. Okay, and if we excuse me, apply our research methods, then we will determine what, you know, cause and effect of different types of phenomena. All right, so black or white, you know, there's no variation to what we see. All right, the positivist, on the other hand, the positivist is very objective. So it's based on facts, no sort of variation in the way that you can observe the facts. Okay? Post-positivist, very many similarities to the positivist type of time. However, Lewis says is we can't absolutely know something because all observations are fallible and have error. And the more information we might have about something, then the theory can be revised. I'm trying to give a good example. So, like hypothesis testing, for example. So when you're conducting a study and you develop a hypothesis, and especially you develop a null hypothesis, meaning that nothing will happen, when you're conducting your research, your goal is to reject the null hypothesis, because then that means that the opposite is true. It would be a post-positivist notion that you can't confirm that something definitely happened. You can only reject that it didn't happen. Does that make sense? It's hard to understand, but
I will try to study more and read more.
well,
But
I think that what happens with this kind of information is as you go along in your program, it'll become a little bit more clear, especially as you take your research courses, because we conduct our quantitative research now is really a post-positivist tradition, meaning we never say, know that the sky is blue. You might say, oh, by all the evidence, based on this data, I can say that that the sky is blue.
okay, thank you very much.
I hope that was okay. I know somebody just said, Ritz just something, and I didn't catch everything that you said. Could you maybe yourself and ask your question?
I have seen the methodology of positivism and post-positivism is experimental, and that
It is.
in the quantitative. And I think that it's the same like way.
It's not exactly the same because what's different is you use the same methods, but interpret the results differently. So say that I'm going to try to think of an example. So say that I found a new treatment for pressure ulcers. And I used it with my with experimental group, and pressure ulcers improved significantly. Okay, much smaller. So if I was a positivist, I would say Pin's treatment treats pressures better than any other treatment. Okay, so that would be like my results. A post-positivist would say, based on the evidence with this trial, clinical trial, the PINS intervention reduces the size of pressure ulcers by 25% over people who use no treatment or something like that. So it's very specific and only is stating exactly what is observed, and it's trying not to put sort of bias in it. Do you know it's a little bit different?
Okay, I'm understand, and I will read it more and more. But I'm sure that if I am interested in to develop innovation to improve quality of care like this, I may choose post-positivism. Yes.
Yeah, I think so. Yeah. Well, yeah, because it's more consistent with how we view now, I think. Yeah.
Thank you.
You're welcome. Now, Ritz, I think you had made a comment, and so I didn't catch it. Could you share that with us?
Hello? Hello? Can you hear me?
We can hear you.
I'd like to share my thoughts about the difference between positivism and post-positivism based from the articles that you have given to us.
Yeah.
Okay?
Share it. Mm-hmm.
I think the difference between positivism and post-positivism lies in the ontology of this paradigm. Be the same in terms of epistemology, that they are objective, and they have the same methods, that they use quantitative, and it's experimental. However, in positivism, the truth is absolute. While in post-positivism, that's not absolute, meaning the truth is relative. It may depend on how the person view the truth. Am I correct?
Yes.
I my thought.
And again, in post-positivist, what that person is saying is that that what we observe is subject to error or bias, meaning that I might see something, but some reason why it's not. So, for example, say on a day that it's really stormy and it's raining, and I look at the sky and I would say, oh, the sky is gray. I'm telling you that it's not blue because right now it's gray. But what is influencing the color is that there are clouds and there's rain and there's all these other things. So that's sort of what we're saying in terms of absolute versus this positivist idea where then be fallible or bias. Okay, thank you. So next person on my list is I'm not going to be able to say your last name correctly, so I'm going to just I can. Yeah, how are you?
You can hear me? Hello?
Definitely.
Okay.
Can you pronounce your name for me?
Okay. K-P-S-U-D-A. Tipsa.
Tuda. Okay. Thanks, Tuda.
Yes.
Excellent.
Good morning.
Good morning.
I'm lecturer mental health and psychiatric nursing at Faculty of Nursing, Thammasat University. I'm interested about methods to help the person who has depression and low self-esteem. I want to know what treatment with effect reduce depressive situation and feeling worthless or low self-esteem. And I found that CBT is a treatment between cognitive and behavioral therapy techniques to treat automatic thoughts and depressive symptoms. And I use music therapy can do depressive situations or worthless too. So, I'm striving to develop conceptual framework of CBT and music therapy. Hello. Okay.
Thank you.
I'm striving to develop conceptual framework of CBT and music therapy to do efficient testing for healing depression and self-esteem in ideal.
Like you're leaning more towards a post-positivist type study.
I don't hear you.
I mean, it looks you're interested in doing a post-positivist type of study.
Yes, feedback on post-positivism paradigm.
Okay. Thanks. Okay, then is last name Get? Monty? Can you? He is a presenter. He is. I mean, it is open. Type in the chat feature. Oh, there you are.
Okay.
Hi. How are you?
I'm fine.
Good.
This is Maggie from Cambodia.
Okay.
Yes. Have you heard something about Cambodia?
Well, I'm sure. I want to visit it someday. I haven't been able to get there, though.
Okay. Actually, my previous job is I was head of nursing department in Cambodia.
Mm-hmm.
And my recent interest is want to study about the health determinant that the Cambodian population in country.
With health, what?
Determination.
Oh, okay.
Yeah.
And do you have any specific ones you're looking at?
Yes.
No, you're still working on it. Okay.
Yeah.
But more from a population health perspective, right?
Yes.
Versus an individual health.
For general, not individual.
So what are you're going to probably look at some health statistics of your country, determine what are the kind of health problems that are most prevalent within the population. Is that right?
Yeah.
Yeah. So I'd say that you're probably looking at more of a post-positivist. Okay. You're looking at quantitative data.
Yes.
Yes. All right. And so this is important because this is another example of the post-positivist. So let's say you're interested in looking at the population of a country, and you want to look at what are the 10 most prevalent illnesses within the country, and then what are some factors that prevent those illnesses. So it would definitely be more of a post-positive approach because it's not looking at cause and effect. Even though you want a sort of association between illness and risk factors, you can't totally identify what cause and effect is because you're not doing an experimental study. So you're looking more at relationships and associations. Does that make sense?
Yes. So I have a question here. So if
Yeah.
I want to collect the data from the population, getting the data from the statistics.
Huh?
The verb for this.
So you want to, I mean, it's hard especially if you're looking at your whole country. So you can go door to door and interview people. So you have to determine what are data sources. And so, for example, like in my country, if I wanted to look at the health of our population, I would look to the Center for Disease Control, which is the central organization that collects data through surveys, and then they compile this data into data sets that readers can look at. So that sort of thing. country?
Actually, most of the data is in OH, the Ministry of Health.
Right, exactly. I mean, you would have a different setup. So I would bet that the Ministry of Health would have similar types of data that a CDC does. And they probably collect it either from surveys or from, do you have like health departments that are around the country? You know, a lot of times they get data from health departments.
Okay. So is there no way to get the data from the health
So the government
personnel,
doesn't share the data? The government wouldn't share it with you?
Usually it's hard to get the data from the government.
Okay. Well, hospitals, are they governed by the Ministry of Health?
Yes, of course.
Everything is.
Hospital is more easy than to get data from the government because in the local you have to contact the police to direct
Right.
he allows them.
You know, sometimes if you're having trouble getting national data, you can look at getting regional data. So say in your area there are 3 community health clinics. You might be able to get data from them and talk about that region that you are in. Help?
Yes, thank you so much.
That would be a challenge, I think, for you.
Yeah.
So that's what you have to do is spend time trying to find out where you can get your data.
Yeah.
Thank you very much. Okay. The next person is, oh my goodness. Yeah, I think no Hornchar? No Hornchar? Yes. Good morning. Say your name for me. Hornchara.
And can have
Okay, excellent. All right.
I'm a lecturer in Sonsunanta Rajapat University. My area is in a research about palliative care.
Here.
Palliative care.
Oh, sorry.
Yeah. And interpretive is more suitable for aim of my research. I have a question about my research. How palliative can be integrated into good diet?
So in Thailand, people die in the hospital, or do they usually die at home? Both.
In Thailand, we have a aging society. The past aging treat illness and palliative care in hospital, but now the palliative in aging is more than
Okay. Do you have like hospice or palliative care that can go to the person's home?
yeah.
Okay, so that's, you have a system of that. And then, do you feel like there are cultural to people getting the appropriate palliative care? Do most people accept, like if the nurse comes to the home and offers palliative care, treatments, either medication or other types of symptom care, is accepted by the patient generally?
Home have a caregiver, the family caregiver.
Mm-hmm.
Yeah.
To listen to the healthcare provider and accept the treatments?
Yeah.
So what do you think is the barrier to palliative care in Thailand?
I think experience to care.
So not enough people to provide the care?
Yeah.
So you need more doctors.
Yeah.
So really, you have a couple of ways to go. And if you're thinking about interpretive, then you would be focusing on the patient. How are they experiencing care? But another focus would be, how do you get more care providers to knowledge about palliative care?
But I don't know.
Thinking if your goal is integrating palliative care into patients experiencing a good death,
Yeah.
then part of it is driven by the healthcare system and the providers, or that is.
I'm trying, but I think I use interpretive, the back end, the post-positivism.
Yeah, you could use either one. Think what you want to do. So I think you're right. The distinction is, if you're looking at trying to gain some understanding about the experience of either the patient, the caregiver, or the nurse, then you would be looking at interpretive. And if you are looking at more of what types of interventions would promote care, then that would be more of a post-positivist.
Does it mean the mixed method, right?
Yeah, you could use mixed method, yes, absolutely.
Thank you very much.
You're welcome. Thank you. The next person is Ormany, who I've met before. Hello, how are you?
See you again. How are you?
Nice to see you. Yeah. Nice to see you.
See you. Okay. Is Mani Patalakimakon from Thammasat University Hospital. Responsibility is about quality management. Adding to my responsibility, I intend to do expertise for hospital nurse service in palliative care.
Also thinking about palliative care too.
It is effective to examine nurse service requirements of healthcare personnel whose palliative care and explore better ways to develop nurse service or palliative team. Objective. The first is to determine the expect need for nurse service of the palliative care team. Second is to examine various model action of palliative care service in university hospital. Is to study nurse person about palliative care and current situation of nursing care service. And I hope to explore activity, and I hope to find the good model of palliative care team. So that I have put is constructivist paradigm.
Okay.
I'm not sure I am is correct.
Yeah, right. Thank you. Yeah, I think you have a lot going on. I mean, I think you're going to study a lot of things. You'll probably have to choose one of those do as your dissertation. You could definitely do it Positivist, because especially if you're interested in looking at nurse perceptions, that's definitely more of a constructivist, interpretive type of paradigm. So yes, I agree. Thank you. Add? Thank you very much. So the next person is Ritz.
Yes. Hello.
Hello.
Hello. Can you
Hello.
hear me?
Yes, you can.
Yes. Okay. I am a faculty at the University of Santo Tomas, and I follow up students in the community. My area of interest is public nursing or community health nursing. I'm interested in developing a model of care that involves partnership that exists between the community, the nurse, to improve their health or well-being. In country, uh, the people in the community are dependent on healthcare providers, particularly the nurse. And one of the issues and problems that we have in our country is do not have enough nurses who can provide these healthcare services for the people in the community. So I am interested to develop a model for partnership so in the community would become independent in
Right.
managing their own healthcare condition. I am thinking of utilizing the interpretative or constructivism paradigm, wherein I would like to know what is partnership for the people, and at the same time, what is the concept, the model of partnership that is for so we can achieve a specific goal of improving their health or well-being. So I need to do a qualitative and a quantitative method of determining what are the variables that are involved, necessary, or the concepts to develop the partnership model. Thank you.
Good. Thank you. That's very interesting. I have two thoughts for you. One is there's a number of communities that have similar problems in that they don't have enough nurses or health care providers to manage the population, and so they have trained community health workers.
Yeah.
So is that something you're thinking about?
Something like that. I'm not yet refined. I am not yet sure on how I am going to do about it. But
Yeah, you might
my idea.
might start looking at that kind of literature, because there are a lot of, especially places that are rural, the places I'm thinking about is Alaska. You know, in Alaska, where because of the terrain and the climate and everything, it's really difficult to get healthcare workers out to these small villages, and so they have people within their village that are trained to be healthcare workers, and they kind of triage, you know, the patients to then the next level if necessary. So that might be a model that you want to look at. Other thing I was thinking about is in terms of the paradigm. You know, this might be a population that you would use the critical paradigm, and you want to consider doing some kind of participatory action research where you actually take people from the community and work with them to conduct the research. It's something to think about.
Thank you for your suggestion.
Yeah, so you have, this is a really interesting project, and it go a lot of different ways, I think.
Yeah, thank you.
Thank you.
Thank you.
All right. And so I think the next person is that correct?
Hello.
Hello.
Hello. Okay. I'm Vipada. Hello.
Okay, got it.
Okay. I'm working at Faculty of Thammasat I'm working at Faculty of Nursing Thammasat University.
Thank you.
I'm instructor of Department of Child and Adolescent Nursing. My interesting area is nursing care in asthma child.
Okay.
Asthma child. From many research, a paradigm of care in asthma is shift. Model of care for asthma symptoms must focus on health team have a knowledge skill to deal with symptoms, but nowadays patients and family are the most chosen to control their symptoms. So I want to start to develop symptom management for Thai school age children with asthma.
Interesting.
Yes, because
that's true. It's family that really needs to be involved in that piece of it. The family has to be involved in the treatment of the symptoms, also identifying the symptoms within the child.
I want aspect in children because they have ability to self-care and manage their health.
Exactly.
So I would to explore the symptom experience and strategy by in manage the symptom and a symptom management program for Thai children.
Okay. Really, go on. Sorry, I didn't mean to interrupt you.
Okay. So, in my view, constructivism or interpretive.
Yeah, I think so
paradigm
too.
has inquiry aim to understand this phenomena.
Yeah, so too, because you're trying to gain some understanding of what the children's experience is, not only with having asthma, but their ability to manage their symptoms. And this will inform maybe another study, which you will develop the intervention.
Okay.
Okay.
Okay, I will try to more.
Telling you to study more. I guess what I'm saying is your study is going to be it's the constructivist interpretive paradigm, because you're trying to understand what the children's experience will be. And I think the goal, not necessarily during your dissertation, but maybe later in your research career, is developing that model care for children. Okay, sound right?
Yes. Yes.
Okay.
Thank you.
I'm not telling you to do more than you need to do. Never. Oh, thank you very much.
Thank you very much for the participation.
Thanks. And then I don't know, there's one more person, but I don't see her on the list. Is it Rataya? Is she? Like she's on leave. Okay, I'm sorry. I think she's here today. So I think everybody has shared their research interests with me, which I think you're studying some very interesting things. I applaud you all. All right. There was that I was thinking about as we were talking. I remember I was taking notes. I think of it offhand, but I guess what I know is if anybody has any other questions about what I've been talking about. A person who says they understand, that's good. Like you're understanding it. I'm very impressed. And what will happen is as you go forward in your career, person who said they you were so saying you missed some information about your research interest. What determines the cause that people? Okay. For example, looking at the health of an entire population, what you do, and this is sort of, I don't know if you're familiar with epidemiology, but epidemiology is kind of the study of group populations and what factors contribute to illness. And there's a lot of different things that can contribute. Some of them can be environmental, some of them can be genetic. They be the kind of nutrition that people can, if they're obese, so if there are lifestyle issues. So there's a lot of different factors. And there's just a lot kind of that's out there. And even before you find a data set, you kind of need to think about what specifically do you want to learn about, because you can't necessarily say I want to study all of the health factors, because that's a lot. What you need to do is focus on something specific. Like, for example, was looking at asthma in pediatric patients. So the whole kind of asthma is very large, but as in children is more specific. So you're talking about the top 10 causes of death, and so that would be something to look at. And then looking at what factors contribute to that, and those factors can be a number of things. As I said, they could be environmental, they could be lifestyle. For example, we're seeing that not only in the United States but in many other countries, obesity is becoming a problem. because, you know, there's a lot of food, fast food, and other things that are contributing to people gaining weight. Is that a factor you want to look at? Do you want to look at whether people, you know, in the community have environmental issues that might be affecting their health? You know, sanitation, water. So you're going to have to try to narrow it down a little bit to see what do you want to look at specifically, because I don't know that you can throw every variable into the mix and come up with something. Okay. Other questions for me? Great. How about anybody else? Okay. I had to switch computers, so I want to just make sure that I cover everything I wanted to cover, because I think my other presentation had in it. Yeah, to all my questions. So I think that it seems like you have a good concept of what the interpretive, constructive paradigm is, and you know, what kind of studies constitute it. There's a little bit of confusion about positivism and post-positivism. It's hard to say, post-positivism. But I think that that's something that you will get as you read more research, and when you, you know, learning more about the different philosophies. Because I believe, according to your syllabus, you are like now going to be looking at specific types of philosophers, and when you do that, you'll learn a little bit more about the differences between, you know, like determinism versus you know, pragmatism, and you know, these other types of philosophical ideas, and so you'll kind of, I think, bit more about what the paradigms mean, and so you might even, just to test yourself, kind of research, or when you're learning about a new philosophy, to like figure out where does it fit in these four areas. Let's see, I'm trying any other last thoughts that I have. In terms of the critical paradigm, that's probably a little bit more confusing because it's not used as much. I think in other disciplines, it's more so, like in social work and sociology, where really sort of looking at almost an activist type of that would be more prevalent. But again, think about if you're working with a vulnerable population, like let's say you were, you know, working with HIV positive, you know, that might be a group where that particular paradigm and types of studies would be good to do. That would be appropriate in that different type of population. So I think that I don't really have any more material to share with you. So we might need to end a little early, and since we didn't have a break, I think that's fine. However, if I don't want to leave without answering all your questions, so it looks like there's another question. So fire. So feminism would be a critical theory paradigm. So like all of those types of theories, feminism, I remember what I said in my So, anything that's related to social, political, gender-based, or ethnic, all those approaches are usually informed by the critical paradigm, or what's referred to as critical social theory. There's a theorist that definitely usually Paulo Freire, Habermas. These people are talking about how to help groups achieve things. Okay, there's another question, or as I said, most of the concepts are easier to understand a little bit. I mean, you'll definitely get mixed up. So nobody, and as I probably said it at the beginning, but if I didn't, then I'll say it now. There's nothing in the science or in theory that is black and white. I mean, people could argue totally wrong and that I don't have the right idea, which I think I do, but because all these things are very nebulous, and so it isn't cut and dry. You could probably say that a study could be, but it also could be that. So, I don't really think there are right or wrong answers. This might be kind of a question that could be on a examination if you're having examinations, but if you have a good rationale or argument for your point, sometimes it's there's one specific answer. Yeah, and you can always reread those articles because they may help you. But you can see that between Cuba and Lincoln, and then the other article, I think it was, let's see, who's it written by? Find the front page of it. Anyway, the one that was about research and paradigms, they are not completely in agreement. So, again, it's not cut and dry. Oh, here, yeah. So the article about demystifying nursing research terminology by Alford and others. They talk a little bit differently than Guba and Lincoln, so it's not like everybody's in agreement over everything. So I would definitely recommend reading the articles. Did you find the articles helpful? Sure. Okay, so they should be used again. Okay, good. Anything that you would suggest that would make it better? PowerPoint? Yes, I can set it. Let me do. Any set PowerPoint? Dr. Paka, would you like to say anything before we close? Any questions, feel free to email me. Let's see. Let me pull up the whiteboard. I don't know if here, I guess I'll put Payal in the chat. Yes, well, take a microphone here. I'll move it to you. If you can speak. Oh. Anybody else want to say anything? Work. Okay. Great. So if I can recommend any authors, I have to say a lot of books, so I wouldn't want to recommend too much more. I used a book. I don't know if there's a recent it's a little old, but it's called Thinking Through Philosophy, which I can citation. It doesn't really talk much about paradigms, but it does talk about different kinds of philosophies. I think that we've said all there is to say. I just want to say thank you for your attention. I appreciate the fact that you've been so engaged in our class and that you've done your readings, and I'm happy that you willing to share your perspective on your research and on thoughts about the paradigms that they might fit. So thank you very much, and if you have questions, I'll be happy to answer them, and I will also send you my PowerPoint later today. All right? So thanks a lot.
Thanks a lot. Thank you for your class today. It we have more understand about philosophy and paradigm, and I think that we will improve my knowledge and our language too. You think so?
Yes.
But we try to speak English more. Improve. I will improve my English skill, and I want to tell you that thank you much for your kindness today. Thank you.
You're welcome. Thank you. I appreciate it. Yeah, I have to say that, first of all, you guys are doing well with your English, and secondly, the more you speak and talk to each other, the easier it gets. And I think that a lot of times when people start learning philosophy, they feel like it's sort of like a dead subject, and why would I want to learn about this, and what will it do for me? But it really does inform everything we that we research. Again, if we were only in like physics, for example, and we're only doing bench science, then maybe philosophy isn't so important. But because we study human beings, we need to have an understanding of people and understand them from different perspectives. So all of this is pretty foundational to what you're needing to learn as a doctoral student. Thank you very much. Bye.